Hey, so I'm always using this platform to talk about nutrition, right? Especially nutrition when it comes to chronic illness, autoimmune disease, anyone who's just not feeling their best. Because if you don't feel well, there's something going on. I want to show you a quick case study from blood work and a sample intake form of this person's nutrition. She is a young 40-year-old healthy appearing woman. She works out every day. She's already gluten and dairy free in her diet. But one thing you'll always hear me talk about when you're not feeling your best, and what we don't talk about and most of us don't yet understand about the liver, is the overabundance of fat and proteins in our diet. So according to her blood work, her white blood cell count is 3.2. That's pretty low, indicating chronic infections. Her monocytes are high. She has insulin resistance going on. She's a very thin, healthy BMI for whatever that's worth woman. She's in the gym. You look at her, you're like, she is healthy. She's struggling on the inside, and I'll relate it all to nutrition in a second. Let me show you a little bit on her lab work. If you can see that her cholesterol is 374. That's pretty high, and it puts her at a risk for some heart disease. And she's only 40. Her albumin's high, her carbon dioxide total is high. What is that telling us? It's saying that the infections in her body have nowhere to go. Her liver, the place that's going to thin, oxygenate, and cleanse the blood, can't do it right now. Why? Let's look at her nutrition really quick. So if you can see here, she's already gluten and dairy free. Look at her breakfast. Most people don't know this. Eggs and bacon, a loaded fat and protein breakfast with ghee, not good for you. There's no carbohydrates. She put in on her intake form, and she is the sweetest girl, and we're working through this together, but she put on her intake form, I eat fruit maybe once a month. What about potatoes? What about squash? And she's like, I've always been told to avoid those for my health. Yet her liver markers, her ALT, AST, way out of range, super high. Liver enzymes are high. Her liver is struggling. Her body is infected. And why? Even if you're super mindful with your nutrition, I can't preach this enough about like low carb, high protein, gym rat diets. A lot of us in CrossFit, we prescribe by this too. The best thing you can do for your health is bring in whole, healthy sources of glucose and carbohydrates, especially if you're not feeling well. People typically feel well switching to a gluten, dairy-free, paleo, even clean keto diet for a while. But one thing she said on her intake form, she's like, I crash every afternoon. I feel like I'm always in fight or flight. My anxiety is super high. Why? Because the liver, it is struggling. And it's the liver's job when we don't eat enough carbohydrates or calories to take the fat and the protein that we're eating. You can see in her diet, eggs in the morning, meat and veggie for every single meal, and nut butters for snacks. There's not enough carbohydrates. So the liver takes that and says, okay, I will take the fat and protein that you just gave me and I'll make it into glucose, those cells' usable form to make ATP in the mitochondria. But for every 1 molecule of glucose I'm going to give you 2 of cortisol. So this poor woman, and a lot of us, so many people I work with, and this is me too, my journey, we're running off of cortisol. And when we have chronic infections, low white blood cell count, cortisol trashes our immune system. Her kidneys are stressed, her adrenals are out of whack, her electrolyte profile needs some help. And what is going to be a really simple fix? We're going to bring in more glucose, more carbohydrates in our calories. We'll probably bring in a little bit of liver healing foods and possibly a little bit of supplementation. She'll be feeling better. 374 is her cholesterol, and she's a 40-year-old healthy gym going woman. You wouldn't think that but the nutrition is everything. So think about that the next time you come across some fear-based functional medicine that tells you avoid fruit, avoid potatoes, avoid anything with sugar. Yes, avoid cookies, candies, cakes, pasta, fruit, squash, maple syrup, honey. These are the things your body needs to make ATP so that you can live, feel well, and fight off infections.